So Barb, as our communities start to reopen across the country, what does Encompass Health see as our next steps to try to get past COVID-19?
Well, I think it's important first to realize that, we're really not past it yet, especially in a lot of our communities. I will say that we will see some changes because we're starting to see some communities reopen as their incidence is low of COVID-19, and we're going to be working to help our hospitals as we look at those reopenings. But it's going to be really important for us to stay diligent in our precautions to keep our employees and our patients safe and healthy.
So what can our hospitals expect in regards to guidance around PPE, visitation policies, and things like that?
First, let me stop to just say I just really want to take a minute to commend our employees for the incredible work that they've done during this pandemic. It's certainly been just an incredible time, and the work that they've done to support each other and their patients has really been remarkable. But what can they expect from us? Well, first and foremost, they can expect us to continue to keep updated on all the CDC recommendations. There are things that are going to be probably part of our norm for a while, like universal masking, where everyone that's coming in the hospital is wearing a mask. But we may see some things change. For instance, the visitor policy. Up to this point, our visitors have really been limited to the primary caregivers coming in for education. But as we start to see communities reopen, we're allowing our hospitals to start having more visitation. May still be one visitor per patient per day, and that visitor is still wearing a mask, they're still getting their temperature taken, but it's allowing the patients to have more family and friends come in than historically.
Sounds great. Good steps for moving forward. So what can our hospitals expect now that acute care hospitals are admitting more non-COVID-19 patients?
Well, we can expect to get busier. Certainly we're already seeing that. When you look at where we are today, we're certainly much higher in our census than what we were in March and April. Now we're not back to the levels that we were in January and February, but we've certainly seen that growth happening. Patients are really understanding that they need post-acute care, and we're doing everything we can to make sure that they know all the things we're doing to make our environment safe for them and for their families.
Is there any other insight that you'd like to share as we continue to look towards the future?
Well, I think what's been really great to see is we have taken care of a lot of COVID-19 recovering patients. Those have been our patients that maybe have been on a ventilator for a week or 2 weeks. They are so weak, there's no way they were going to be able to go home from the acute care hospital. They've come to our hospitals, they've received the rehabilitation, and the outcomes have really been remarkable for these patients.